Hi, Dr. Meri Rosco here. Today I wanted to discuss how sports can lead to degenerative disc disease. In previous videos, I've discussed discs and disc degeneration. So just to review, these are the discs located in between the vertebrae. When they start to degenerate, they actually get smaller, lose nutrients. The bones around them, the vertebrae, will start to deform, and then the disc itself can actually herniate and hit a nerve, causing pain. So looking at two studies that I wanted to discuss today. The first study is a Japanese study that looked at baseball players, swimmers, elite gymnasts, soccer players, and weightlifters. And they found that by using MRI imaging to view the spines of these players, that baseball players and swimmers had the highest incidence of degenerative disc disease. They also found that certain movements contribute to degenerative disc disease in these sports. Movements are jumping. So obviously jumping is gonna load that spine. It's gonna put pressure on the disc because it's loading from both directions when you jump up, when you hit the ground. And then twisting motions. So they call that frequent trunk rotation, but any kind of twisting motion, kicking motion, which is also rotating the spine, and then a lot of repetitive flexion and extension movements. So that's bending forward and bending back. They also found that a severe bout of low back pain during your younger years, so during your child years, your youth years, is a good predictor of degenerative disc disease in the future. So whatever trauma or overuse injury that caused that episode of low back pain usually shows that there's an abnormality in the spine, and then the abnormality becomes degenerative later on in life. The second study I wanted to discuss is a Swedish study that also used MRI, looked at 71 random selected athletes, and they found that there was a lot of abnormalities of the spine, so not just degenerative disc disease, but abnormalities in general in ice hockey players and wrestlers, and then degenerative disc disease, particularly in ice hockey players and weightlifters. They found this degeneration to be mainly in the mid-back and the low back. And they found that 92% of these athletes had an abnormality in the spine, while 48% of non-athletes had degeneration in the spine. So it's quite a difference. And then the movements that they correlated with degeneration were, again, that flexion and extension, so bending forward and bending back, as well as rotating, so turning side to side. They believe that ice hockey players were most at risk because they're skating, so one, they're going to be knocked off balance when impacted, and they're also usually coming at a high speed prior to or during the impact. So that's going to increase the force. The MRIs done on the younger population in this study found that abnormalities in youth during their growing years, so when your kids are starting to mature and go through growth spurts, if there's any abnormalities in the spine there, they do lead to degeneration later in life. So obviously degeneration isn't instant. It takes many, many years to build. But when something happens to you in your younger years, those injuries will lead to degeneration later on. And their conclusion from this was that a growing spine can be highly vulnerable to trauma. The good news is that there are ways to prevent this, to keep your spine healthy, to prevent further degeneration if degeneration's already occurred. This is through chiropractic treatment, through decompression therapies, and a lot of other therapies that help to rebuild and strengthen the spine. I hope this was helpful. If you have any questions, feel free to reach out to me at Vizendi Chiropractic or leave a comment below and we'll get back to you. Thank you.